My name is Dan Tache. I am a dentist practicing dental sleep medicine out of Appleton, Wisconsin. And my practice is limited to oral facial pain, TMD, and dental sleep medicine. And I've been using Echovision, acoustic pharyngometry rhinometry, for the better part of 15 plus years. I can tell you, when I started in my practice, there was a doctor who had been at it a number of years prior to my involvement and had a great reputation. And since he was one of the few people, he got all the referrals. And then I came along and I tried to get to know this man, and I looked for mentorship, and it was not available. He was not the least bit interested in jumping in bed with the enemy, so to speak. So that's okay. I had a lot of support from Sleep Group Solutions, and I had technology he did not have. Dan Tache et al. Got noticed, and we started getting very busy, and ultimately we surpassed that person. It was probably within just maybe about 3 or 4 years he retired, and it became so apparent that our patients were so much better treated that our practice took off, and I was able to at last limit my practice to my two passions, TMD and oral facial pain and sleep. You want to know if you have nasal breathing problems, do you have nasal valve collapse, do you have severe septal deviation, but more importantly, do you have turbinate hypertrophy? If you have any one of those, especially valves and turbinates that are collapsing / hypertrophy, you're not going to be able to keep your mouth shut and breathe through your nose, and a PAP or an oral airway device won't work as well. With rhinometry, acoustic rhinometry, you'll learn about your high upper airway early on, and you'll get that corrected early so as to optimize success of your oral airway therapy device. With pharyngometry, you see in real time where and to what extent your airway is collapsing. And you can see in real time, again, if it's going to respond. And if it's not going to respond, you have that conversation early on, and you tell your patient, we might need hybrid-therapy. You might need to consider PAP therapy, unless your airway really heals, which they do, sufficiently that the oral device alone might not get it. You'll know well in advance how to advise your patient on what their expectations for treatment outcomes will be. Acoustic pharyngometry and rhinometry are evidence-based tools that help us determine if mandibular repositioning will be an effective approach to stabilizing their airways and eliminate obstructive sleep apnea. The Sleep Group Solutions Mastermind in Miami, the first meeting of its sort, to me was a tremendous success. And I think the reason why is people are there because of their passion for patient care of a problem that can affect their very life. And they're not there because it's Miami and it's the winter time. You know, sure, that's another good reason to go, but they're there because they're passionate and they're confident, because we're not winging it like we used to before we had this technology, where we're hoping and praying that kicking the jaw forward was going to get it done. These people are there because they know they've got something to offer to their patients and the whole world needs to know about. And we're sharing information to improve our ability to treat these patients even more. And so it's an academic weekend, but it's populated by people, the kind of people I want to be around, people who are passionate and putting their patients first and foremost. And it was a great experience. I was able to speak on a couple topics that I was passionate about and knew a little bit about, and that's kind of how it went. We're sharing and we're being shared with, and I learned a tremendous amount. And so when I was asked to do this, I said to myself, it's the least I can do to give back for a program that really fed me a great deal. So I hope to see you at the next SGS Mastermind session, wherever it is, even if it's in the middle of the winter in a cold place like Wisconsin. All right, thank you.